Good morning. Today I am going to talk to you on obesity and its problem. As you are aware, today there are more number of people who are obese than the people who are suffering from malnutrition. That is the fact and fate. There are more than 1.7 billion people in the world who are obese. The top in the list is United States. Around 50 to 60% of them are overweight. When you talk to the underdeveloped or developing countries like us, India, China, and other South Asian countries, the obesity is not lagging behind. In children, it is around 15 to 30%. In adults, middle-aged women, it starts from 30 to 40%. It is most of the time in the societies is assumed that obesity is about the looks. More important than the looks, it is a problem of health. Today, India being the capital of the diabetes, we don't have to further stress on the fact that is mostly contributed by obesity. Almost 75% of the diabetic patients suffer from obesity. There is a difference between overweight and obese. When the person's approximately the BMI is more than 35, it is called obesity. Between 25 to 30, it's called overweight, and more than 30, it's called obesity class 1. So in terms of a common or layman terms, if somebody is overweight whose weight is more than 25 to 30 kg, more than what ideal weight, then conveniently he comes under the category of obesity. If you look at it, how it affects the individual, a family, a society, and the country and the world. Billions of the dollars are spent on trying to treat the obesity and its related medical problems. If you look at the obesity, how it affects. So it is, in short, we can call it as a mother of all diseases. There is no organ in the body which is not affected by the obesity. It is a problem which affects from the child to the elderly. Simply we can call it, it's a problem which affects from womb to tomb. Address problems at various angles. It's no more a problem of an individual. It is a problem of country, problem of society. If you look at the children, how it affects the children, this is the only, if you look at what is the definition of the WHO, not only physical, it is not a lack of disease, it is a physical, mental and social well-being. Obesity is the one problem which affects physical health, mental health and social health. If you look at the physical health first, it is the most number one cause of the diabetes. It is the cause of the majority of the hypertension. It is the cause of cardiovascular problems, young age strokes. It is the cause of pancreatitis. It is the cause of gallstone diseases. Because of the obesity, many people develop exertional dyspnea. That is, they can't walk fast, they can't climb the staircase. And that results what is called as sleep apnea. So these people, whenever they sleep, there is obstruction in the airway, and that results in the hypercapnia, increased carbon dioxide in the brain. They need to wake up in the middle of the night, they can't sleep it. And a chronic hypercapnia or increased carbon dioxide levels can affect the person's personality. They become irritable, they can become reclusive, they become mental wrecks. Apart from this, obesity causes various problems. If you look at why each problem occurs because of the obesity. Obesity is simply excess fat accumulation. It is not a muscle, it is not a bone. Unfortunately, whenever we are a particular height, we have a fixed heart size, we have a liver, a pancreas and lungs which don't grow very much. They are fixed in size. If the person is supposed to be 60 kg becomes 100 kg, the same heart, the same lungs and the same kidney and same pancreas and same liver has to supply double the time. So they need to work. When they need to work, they strain more. When they strain more, they fail. That's how it occurs, the problem.